realize
much
that
as
you
I
have to put something objective, and that's what makes it easy for somebody. We're very obsessed with numbers. We want to see a weight. We see a weighing scale today. We see 65. We see 68. Tomorrow we are shocked. We see 62. The next day we are feeling better. So it's always better when you, especially when you have an asymptomatic disease, you want to tell them that and if you tell them to do 25 tests, nobody is going to be happy about it in today's world. So keep things simple, but at the same time be aware. And we many times we see this unfortunate event. Patient comes and says creatinine 3.5. Sir, now tell me what I should do. And by the time it's too late, and we feel like, okay, if only this patient had somebody to tell them this 5 years before or 10 years before, it would help so much. And even our chief used to say, the lesser patients we have, the better. But in our world, we're just going to keep having more and more, and it's unfortunate that way. So that screening, that primordial prevention, that avoiding kidney disease is something that we really want to push out to everybody. And I'm sure for people listening to this would have really helped them understand that our aim is only to make them understand how simple things are and how careful we should be about certain things. And to be very honest, I'm really happy that you have doing this as absolutely out of your own interest and passion. And people are just getting this knowledge from you, and it's a wonderful initiative. And I'm happy to be a part of it in some way.
thank you so much, Doctor. So thank you very, very much. And any final message you have for any audience? Actually, you concluded, but any final message you particularly about kidney?
I think the main thing is adopting lifestyle measures, that keeping yourself hydrated, and keeping those dietary changes, keeping a lower salt. And also people who have kidney disease in the family, sometimes it's genetic. So getting yourself checked early, and periodic follow-up, and those are what are primarily important. The main thing is it doesn't cause symptoms, which is why kidney disease is something that should be spoken about a lot more than this. Not many people know a lot about, we see about stroke, we see about brain, we see about heart, we see about lot. But because it's asymptomatic, because it doesn't cause problems, and it's only at later stage that we understand that the kidney has failed or kidney is losing its function. Which is why that awareness has to be more, and services have improved a lot. And I would tell people that that is the strong message. There is always hope. Don't resort to some measure as an urgency. Don't go and get confused. I've seen people who are very well educated, very knowledgeable, but then they get bamboozled into some kind of a magic pill practice, and they lose follow up and take native medications. To be very honest, my one of my patients, he ended up to the stage that he was on follow up, and then he reached to the point of dialysis, and his creatinine was around 8. And he said, "Sir, you've told me not to take any medicines for tongue. You're going to be, I'm going to dialysis now. Can you at least now try and see if these native medications work?" So people are somehow always fascinated by some alternative option, but it's never that easy. And and now it has changed a lot. There is no need to be fearful about dialysis. There is no need to be fearful for trying a solution. The solution will have complications, but I'm sure a nephrologist will guide you through and will walk you through those complications with you. And that is what is the primary thing. And what I would say is find somebody that you really trust and build that patient doctor relationship better. I think that is where somehow over the last decade or so there seems to be a lot of friction. That prior patient doctor trust and relationship is probably breaking a bit or kind of fractioning a bit due to many reasons. And I think that should somehow, I think we are also responsible in many ways. So building that trust, back and say, okay, sir, I don't, as you rightly said, no, I am an engineer. So I wouldn't be a person who goes and says, let me fix the TV or the internet or the machine without having a knowledge. But somehow when it's healthcare, people have their own viewpoints, and people end up going the wrong path. So allow an expert to treat and make sure that you don't make any wrong decisions, and always understand there will be hope despite all your problems.
Yeah, only one message, Doctor. So,
Yes.
so especially with Dr. Muthu Jayaram, my mom, when she was alive and she was diagnosed with CKD4, and the relationship with the doctor and then the mother, I literally saw that actually. So I used to prepare a list of questions actually, what to be taken, what to be avoided, and I used to make a very nice graph of and how the creatine is going up, and all that. I used to prepare very for the meeting of Dr. Muthu Jayaram. I used to prepare a lot actually. So what happened actually? These two, mother and doctor, they sit together. They just talk a lot, and then it was making lot. I think more than the medicine and the trust. My mother built on doctor. Doctor builds on patient. I think it's a remarkable, and at the final one also she didn't go through the dialysis everything and all that, right? So I think
And
when you touch upon that point, I'm very fascinating. Have a story of my mother and one, so always they literally talk each other, and then as though they are part of the family members and all that. I think in the beginning when you said the word that Dr. Muthu Jayaraman treats all the patient as a family member, and many of the viewer also have quoted the word called motherly advice and all that, right? So I can 100% vouch that statement as such, doctor. So I'm sure
And
that
that's
you will
another thing,
also will
as you
become.
rightly said, wonderful, sir. As you rightly said, we always put the final decision to the patient and the family. So we realize that, there is no satisfaction in just saying, sir, your creatinine was 7, now it's 5, now it's 4. No, that doesn't give a patient satisfaction. They want to sleep well, they want to eat well, they want a good quality of life. There are people that we say no to dialysis also, even if science would say dialysis is best for them, if they are not willing or if they are not comfortable or if they are not happy with that option. Because just bringing down a number will not give you satisfaction if your sleep, your appetite, your quality of life is getting impaired. So there have been people who we've said withdraw dialysis. Dialysis doesn't work for you. So rarely we say, maybe age, maybe some factors, we say you stop dialysis. That's why I think respecting the patient's wishes and giving them what they want is what actually completes that loop. And that is something that I think ma'am also does very much for most of our patients.
Thank you so much, doctor, for all your time or for all your details, everything. I'm sure that this will be helpful for everyone. Thank you so much, doctor. Take good care of yourself. Thank you,
Yeah.
doctor.
Thank you, sir. Thank you for having me.
Thank
I think we've crossed the time that we scheduled, but yeah, we'll be
all
happy to answer questions or
lovely,
anything. You
Nagar,
can
all
contact at
lovely.
any time. Yeah.
Sure, doctor. Sure, doctor. Thank you, doctor. Thank you. Take care.
Okay, sir. Yeah. Yeah. Thank you.